My specific question is, in my case, I would want a breast lift. And how would that affect your nipple sensation? Is there a complete loss, or how does that all work?
Okay. Now, I want everyone to understand that the breast is the nipple and everything else underneath the skin that you don't see. For instance, my nose is under my skin. So when people talk about their breast, they're talking about really the nipple and everything else underneath. When we do a lift or a tuck, we're dealing with skin. And the procedure involves skin, not really your breast. It just happens to be skin where your breast is. So it doesn't hurt, and there's no downtime with it. It's like touching a cut, it hurts. You don't touch, it's fine, so don't touch it. There's less than 1% risk of loss in sensation anytime you make incisions around the nipple with this lift. And the breast lift, basically what we do is we remove the extra skin that's around the breast, which tightens the breast. And it doesn't really involve the breasts. It's a skin operation. So your breast will function, everything functions. It's just a less than 1% risk of loss in sensation. Usually that clears up within a year.
Okay. And what about, say, I'm assuming there's, in the mommy makeover, a tummy type of tuck?
The mommy makeover is not a specific procedure. The mommy makeover is any procedure that you want to make the mommy over. So it's individualized. There is no such thing as mommy makeover. There is no such thing as facile bladeless surgery. There's no such thing as lifestyle lift. These things don't exist. A facelift is a lifestyle lift. Facile bladeless surgery doesn't exist.
All right. Well, then on the tummy tuck, would you suggest, likewise with your previous caller, I do have that pouch, but since then I've gained some weight, probably suggest I lose the weight first and then come for the tuck?
No, because this is what happens. You can't target a spot on your body. Once you've gained it there, it's not easy to remove it there. It comes from other places. So it may be a combination of doing liposuction and then down the road doing a tuck, or a tuck, then lipo. Reducing fat doesn't create extra skin. You have to have the excess to start with. So if we did a tuck, you don't have any extra skin. Then we could do lipo, and you still don't have any extra skin. Or you do lipo, and then you can do a tuck. Or you do lipo, and the skin retracts on its own, you're done. So it really depends on you.
Lisa, thank you for your call. 800-859-0WJR, 800-859-0957. We'll take a break. Come right back with your calls. Hold on. We'll be right back with Dr. Michael Gray of the Michigan Cosmetic Surgery and Skin Deep Spa. And he'll have more answers for you as this special edition of The Big Story continues here on News Talk 760 WJR.
Welcome back to this special edition of The Big Story. Tonight, Lloyd's special guest, Dr. Michael Gray of the Michigan Cosmetic Surgery Center and Skin Deep Spa. Call WJR now with your cosmetic surgery questions for Dr. Gray at 800-859-0WJR. That's 800-859-0957. Once again, here's Lloyd Jackson.
And if you'd like more information on Dr. Gray, visit anewyou.com, anewyou.com. And his office number is 248-538-3333, 248-538-3333. Our call-in number tonight, 800-859-0WJR, 800-859-0957, if you have a question for Dr. Michael Gray of the Michigan Cosmetic Surgery Center and Skin Deep Spa. Jessica's been waiting patiently from Bloomfield Hills. Jessica, what's your question tonight?
Oh, I'm sorry. My name's Mary.
Oh, okay, Mary. Sorry about that. What's your question?
Oh, you know what? I don't actually have a question. I had surgery with Dr. Gray about 6 months ago. I'm one of his patients.
Oh, okay.
And I just got home. I was just listening to the radio station. I heard him on there, and I heard the last couple callers, and I just want to first of all thank him, and because I love the work he did. He did liposuction and breast enlargements, and I just want all the, everyone who's wondering or having any questions to just make a appointment and go see him, because he's amazing and he really knows what he's doing, and he's a perfectionist.
Mary, thank you so much for your call.
Thank you.
All right.
Thank you.
Let's go.
Nice.
It's always nice to have a person who has...
you know what happens? Gets me in front of the line in the restaurant.
There you go. Let's go to Joe on line 3 from Dearborn. Joe, what's your question tonight?
Hi, Dr. Gray. I have a question. I had a transplant about 10 years ago, and I'm on the drug prednisone for the last 10 years. Is it possible for somebody with a condition like mine to get a tummy tuck or liposuction?
Yes. I mean, I've done it for patients. They've had liver transplants. I've had heart-lung transplants in my office, kidney transplants. There's nothing wrong with it as long as your doctor that's watching you continues to watch you and he's aware of what we're doing. It's fine.
Okay, great. Thank you so much for your time.
You're welcome.
Thank you, Joe. 800-859-0WJR, 800-859-0957. Carol's calling from Trenton. Carol?
Hey, how you doing?
Good.
A question I have, Dr. Gray. My wife, and I mean this the best way possible, is very well endowed. Up top, she has massive back pain. I mean, massive back pain. We have tried to get her taken care of for years. She's 31 years old. She's got diabetes. She's got a history of cancer in the family. All this. We haven't found any lumps or anything like that. But the question I have is, we've been trying to get her a breast reduction. What I'm saying, do y'all do things like that, or will most insurances cover it? And they've been saying they wouldn't cover it because it's cosmetic surgery. I mean, how would we get it covered, or what would I have to do to get it taken care of as far as back problems?
Well, here's the thing. I can't speak for the insurance companies. Most insurance companies don't cover anything anyway. But in your situation, I can't say that it would be cosmetic, but you can do surgical and you can do non-surgical breast reductions. One way to reduce the breast non-surgically is we can just reduce it with the external ultrasonic-assisted lipo, which basically reduces volume. It doesn't destroy any function of the breast. Everything functions. There's no downtime. If you want to do to the classical breast reduction, you can do that with incisions where you're reducing quadrants of the breast and reconstructing the breast. There's two ways to approach things, different ways, different risks. But I'd have to see you in the office.
Jeff, thank you for your call. That's Jeff from Warren. Let's go to Carol now from Trenton. Carol, are you there?
Yes, I am.
Go right ahead.
Thank you very much. Hello, Dr. Gray.
Hi, Carol.
Listen, I'm calling in regards to a deep wrinkle on the side of my mouth.
Stop smiling.
What?
Stop smiling.
Oh, I try to do that anyway.
Yes.
But I'm at the age where I'd like to have that taken care of because it does age you.
Yes.
And I do take a high blood pressure pill, so is that that's one of my concerns.
That wouldn't affect anything. We can treat that with there's facial fillers, there's temporary and permanent fillers. Alloderm's permanent. Everyone's heard of Restylane and Juvederm, Perlane, Radius. There's lasers that iron the skin, CO2 lasers. And then there's someone doesn't want to go aggressive with that. They can do Fraxel. Looks like a sunburn. We can treat it slowly or aggressively. Basically, just make an appointment, come in, we'll take a look at it, and you don't have to worry about your blood pressure pill.
So is that a one-day procedure, and will I be able to drive myself home?
Yes. Yes.
Okay, another question for you, Dr. Gray. I am now in my big 7-0, and I have lost 80 pounds.
Congratulations.
And I have this little apron in the front, and I would like to have a tummy tuck. Am I too old for that?
You're never too old. It's how you are, not the number. So,
okay.
No, you have many, many, many more years in front of you.
Well, yes, I do, and I'm looking forward to that.
Right, just be careful to smiling.
Okay, I will keep smiling, and thank WJR and that's Mr. Jackson very, very much for having you on the radio. Bye-bye now.
Thank you,
Bye-bye.
Carol. Boy, I'm telling you, Carol's, she's ready.
She's a go-getter.
Yes, absolutely. 800-859-0WJR, 800-859-0957. Let's go to line 5. Alan from Brighton. Alan, what's your question tonight for Dr. Gray?
Good evening. My daughter had an accident when she was young, and as a result of that, she has a scar on her face that's about 3 inches long. I'm wondering at what age would be appropriate for her to look at having that scar revised.
How old is she?
She is 16 now.
Now's the time.
Okay. And what sort of improvement can be expected from a procedure like that?
Well, there isn't any one procedure that does that. I'd have to take a peek at her to see what it is going on, then formulate a plan. It's not something that you can answer really without being seen.
Okay. Thank you very much.
Alan, thank you for your call. Dr. Gray, I just want to quickly talk a little bit about the deep skin spa, the skin deep spa that you have.
I'm going to change it. I like that. Deep skin spa. That's better. Okay. Wish I thought of that.
There you go. I gave you a freebie tonight. So many things that's done there, including acne treatment and tattoo removal. You see that as well? A lot of people with tattoos now.
Yeah. The big mistake.
Mm-hmm.
Yeah, we just had someone in here just recently that said they made not only one, but 3 or 4. But yes, unless the tattoo means something to you, you're not going to keep it. Taste change, clothing changes, your taste in piercings and tattoos always change. But the Skin Deep Spa it's not really like a spa, even though we offer those services. What we do there, it's the non-surgical, aggressive interventions in skincare. So what we do is we have all these lasers that help treat scars and acne. We have lasers that help prevent acne. We have Zerona laser now that eliminates the fat that's within the cell. The body releases it. We have treatments for cellulite. We have Dermosonic and Triactive. We have Wellbox and ProPower, all these different machines. We have Fraxel laser, which helps with treating the imperfections of the skin with no recovery. Laser Genesis, Pearl laser, laser hair. We have the new laser on the Zeo platform, which treats any color skin.
Okay.
There's a whole host of procedures that we offer. And when people come to us, they go, wow, you offer so much. Well, we're one of the practices in the country that has the ability to offer you so much.
800-859-0WJR, 800-859-0957. Let's go to the phone lines. Line 1, Angie from Clarkston has a question for Dr. Gray. Angie, good evening.
Hi, I have a question. I've had injections before, a Restylane injection to my lips, and I loved it, but it only lasted about 5 months.
Doesn't that suck?
Yes.
It only lasts 5 months. That's where you would start looking into something permanent. What I say to my patients, if you want this treated, why would you go to something temporary? And Alloderm is a solid strip of human collagen, the same collagen in your body. And what we do is we add it to your lip, and you keep about 50% of it forever.
Oh. It sounds great.
It is great. And it feels just like your lips, soft, wonderful.
Okay, perfect.
Okay.
Thank you.
Angie, thank you for your call. Let's go to Ken now, who's calling from Clarkston as well. Ken?
Oh.
Go on with your question, Ken. What's your question tonight for Dr. Gray?
Yes, Dr. Gray. I have sleep apnea.
Yes.
And I was told that the size of your neck sometimes creates the problem. And I have excess fat underneath my chin and on my neck. And I wondered what procedure might be advisable.
A very easy procedure. You can come in 15 minutes, 50 to 75% of it will be gone. Just make a small little puncture hole underneath the chin, one behind each earlobe, and reduces the volume of your neck.
Okay. Could that be an insurable event?
No, that couldn't.
Okay. Thank you very much, sir.
You're welcome.
All right, Ken, thank you for that. Let's get one more quick call in here before we go. Robin from Allentown, Michigan. Robin, what's your question tonight?
Yes, I was just wondering if there was anything you could do to correct inverted nipples.
I'm glad you brought this up. This is one of the things that most women don't even know, that there is a fix out there. It's not even 15 minutes. It doesn't hurt. Basically, you ever see a cowboy hat? It's inverted. I can evert the hat very quickly in the office, and you can do it on the local. It doesn't affect sensation, and then they won't be inverted anymore.
All right, and let's squeeze Rich in here really quick. Rich, what's your question tonight for Dr. Gray?
Hi, Lloyd. As usual.
Thank you. Real quick, Rich.
I'm a heart patient, and I know I need some liposuction, but I didn't know if you would do anything on a heart patient.
You'd have to be cleared by your physician.
All right, Rich, thank you so much for your call. Dr. Gray, the time goes by so fast. Thank you for coming in, and I can't wait to have you back in again.
I'll be here.
All right.
Thank you.
Thank you for listening to The Biggest Hour on Detroit Radio. My producer is Rosanna Kelly, who's out ill today. Phil Betterow, doing a fabulous job, though. Filling in tonight is Ken Rogolski. My engineer tonight, Dana Clark. I'm Lloyd Jackson. See you back here tomorrow at 7. And remember his number, Dr. Gray's number, if you need to call him tomorrow, 248-538-3333. 248-538-3333. I'm Lloyd Jackson. Remember, if it's big news, you'll hear it here on The Big Story.
Talking about what matters to you. Catch it live on News Talk 760 WJR AM and stay up to date online at WJR.com.